You're over 40 and suddenly things feel different. Is your skin itchy? Are you awake at 3 a.m. staring at the ceiling? Does your deodorant stop working out of nowhere? You wonder, is this stress? Just getting older? Or is it something your doctor never warned you about? These odd, annoying changes might be signs of premenopause, a stage most women enter without even realizing it. In this video, we're breaking down 11 surprising signs that could mean you're stepping into premenopause. If you're confused, frustrated, or just plain curious, you're in the right place. Let's dive in. Sign number 11, changes in body odor. Have you noticed that your body odor has changed without switching products, diet, or routines? You're not imagining it. Shifts in body odor are a real and surprisingly common symptom of premenopause. As estrogen declines, it disrupts your skin's microbiome, the natural balance of bacteria that lives on your skin and helps control scent. With that balance thrown off, you may start to smell different, even to yourself. This can affect your underarms, feet, breath, and even vaginal scent. Some women report having to change deodorants frequently or feeling like their body just doesn't smell the same anymore. Your sweat glands are also influenced by hormone levels. So when those hormones fluctuate, so does sweat production, composition, and how it reacts with bacteria on your skin. While not dangerous, it can feel embarrassing or confusing, especially when your hygiene routine hasn't changed. But knowing it's connected to your hormones can take away the shame. It's not poor hygiene. It's your body adapting to a new hormonal chapter. Sign number 10, itchy ears and skin. Yes, your ears. That odd sensation inside the ear canal, or on your skin in general, might be more than just dry air or allergies. As estrogen levels begin to drop, your skin can become noticeably drier, thinner, and more sensitive. Estrogen plays a big role in maintaining skin hydration, oil production, and elasticity. So when it starts to decline, your body notices fast. The inner ear, believe it or not, has delicate tissue that's prone to dryness, making it a surprising hotspot for that crawling, irritating itch. And it's not just your ears. You might notice itchiness on your arms, legs, chest, or even your scalp, areas that suddenly feel irritated, flaky, or uncomfortable, even if you've never had skin issues before. Some women even report feeling like their skin is crawling or tingling at night. Most women don't connect this to hormones, but if you're over 40 and battling random, persistent itchiness with no clear cause, it could be a subtle sign that your hormones are shifting. If this sounds familiar, you're not alone. And now, you know it's not just in your head. Sign number 9, ringing in the ears. A ringing, buzzing, or whooshing sound in your ears that no one else hears. That's called tinnitus, and while it can have many causes, for some women, it's linked to hormonal changes, especially during premenopause. Estrogen and progesterone don't just regulate your reproductive system, they also impact your nervous system, including how your ears and brain process sound. When hormone levels fluctuate, it can affect the tiny hair cells in your inner ear, leading to that phantom noise that just won't quit. If you've been to the doctor and ruled out ear infections, medications, or hearing damage, and you're still hearing those sounds, it might be time to consider your hormones. Many women are surprised to learn that their tinnitus started during perimenopause, and in some cases, fades post-menopause once hormone levels stabilize. This symptom often flies under the radar because it's rarely associated with female hormones. But if you're over 40 and tinnitus is suddenly on your radar, your body might be sounding the alarm, literally. Sign number 8, migraines or new headaches. You've never really had migraines, and suddenly they're part of your weekly routine. That could be a red flag. Hormone-related migraines are extremely common, especially when estrogen levels fluctuate. Estrogen affects neurotransmitters like serotonin and how blood vessels expand and contract. When those levels swing up and down, as they often do in premenopause, it can trigger powerful headaches. Some women experience menstrual migraines even before premenopause, and these can intensify as hormonal shifts become more erratic. Others develop headaches seemingly out of nowhere, often waking up with them and seeing them fade as the day goes on. If you notice headaches becoming more frequent, especially around the time of your period or during high-stress weeks, hormones could be the hidden culprit. And if you're also dealing with sleep disruption or mood swings, that just reinforces the connection. Migraines during premenopause can be debilitating, but understanding the link gives you a path forward. Sign number 7, burning mouth or gums. Ever feel like your tongue, lips, or gums are burning or tingling, and your dentist says everything looks fine? Welcome to one of the strangest yet medically recognized symptoms of premenopause burning mouth syndrome. This uncomfortable sensation is often tied to hormonal shifts, especially declining estrogen, which can affect the nerves and moisture levels in your mouth. Estrogen helps regulate saliva production and maintain a healthy oral microbiome. When levels drop, saliva can dry up, changing how your mouth feels and making it more prone to irritation or inflammation. You might also notice a metallic taste, more cavities, or increased sensitivity, especially to spicy or hot foods. These changes can be alarming, but they're not uncommon. The frustrating part: many doctors and dentists don't connect this symptom to hormones, leaving women without answers. If your mouth feels off and you've ruled out other causes, your hormones might be to blame, and relief might come with better hormone support. Sign number 6, joint pain and morning stiffness. Waking up feeling like you aged overnight? Achy knees, sore hips, or stiff fingers. Joint pain is one of the most common, but least talked about, symptoms of premenopause. Estrogen has anti-inflammatory effects and plays a role in maintaining joint health. When levels drop, inflammation can rise, and joints can feel sore, tight, or stiff, especially in the morning. It's easy to dismiss as just getting older, but the sudden onset of joint discomfort, especially without injury or overuse, is often linked to hormonal changes. Some women describe it as bone pain or deep stiffness that improves throughout the day. Others feel like their flexibility or strength has dropped, even if they're active. If you've recently started waking up achy or stiff and stretching doesn't cut it, your body might be reacting to lower estrogen levels. The good news? Recognizing the link can help you explore solutions, ranging from movement to diet to hormone therapy. Sign number 5, heart palpitations. That fluttering feeling in your chest, the sensation that your heart's racing while you're sitting still, it's not always anxiety or too much caffeine. For many women, heart palpitations are an early sign of premenopause. Estrogen and progesterone both influence the cardiovascular system, and fluctuations in these hormones can impact your heart rhythm. Progesterone, in particular, has a calming effect on the heart. When it drops, especially in relation to estrogen, it can create a feeling of unease or irregular heartbeat. This can happen during rest, sleep, or even mild activity. Of course, any new heart symptoms should be checked by a doctor to rule out serious conditions. But once that's done, if everything looks normal on paper and your heart still feels off, hormones might be the missing piece. This symptom can feel scary, but knowing it's common and usually harmless can bring major peace of mind. Sign number 4, trouble sleeping. You're exhausted, but the moment your head hits the pillow, nothing. Or you wake up every night at 2 a.m., unable to fall back asleep. Sound familiar? Sleep issues are one of the most frustrating symptoms of premenopause. Hormones like estrogen and progesterone help regulate sleep cycles and promote deep, restful sleep. As levels dip, so does your ability to stay asleep or feel truly rested. You may struggle with falling asleep, frequent night waking, or even night sweats disrupting your rest. And if you've always been a good sleeper, the change can feel jarring. The domino effect? Poor sleep leads to fatigue, mood swings, foggy thinking, and more stress, which all worsen hormonal imbalance. It's a vicious cycle. If you're wondering why your energy is gone and nothing helps, your hormones might be sabotaging your sleep without you realizing it. Sign number 3, mood swings or anxiety. Do you ever feel like your emotions are all over the place? Mood swings, anxiety, irritability, and even depressive feelings can spike during premenopause. That's because estrogen and progesterone directly influence brain chemicals like serotonin, dopamine, and GABA, all responsible for mood stability. As these hormones rise and fall unpredictably, so do your emotions. One minute you're fine, the next you're overwhelmed, anxious, or snapping at people you love. For many women, these emotional shifts are the first signs that something is changing. Unfortunately, they're often brushed off off as stress or just being hormonal. If your moods feel more intense or unpredictable than usual and there's no obvious trigger, it might be time to look at your hormones. You're not unstable. You're not broken. Your brain is just reacting to a powerful internal shift. Sign number 2, irregular periods. Let's talk about the obvious one, your period. In premenopause, irregular periods are extremely common. Cycles might get shorter, longer, heavier, lighter, or suddenly disappear for months, only to return unexpectedly. Why? Because your ovaries are no longer releasing hormones in a consistent pattern. Ovulation becomes more sporadic, and with it, your cycle becomes unpredictable. Some women notice more intense PMS symptoms, heavier bleeding or spotting between periods. Others may skip a period and think it's menopause, only to have it return a few weeks later. While annoying, this is a normal sign of your body transitioning. Tracking your cycle can help spot patterns and help your doctor understand what's going on. The key takeaway? Unpredictable doesn't mean abnormal. It just means your hormones are in flux. Sign number 1, sudden weight gain or slower metabolism. You're eating the same, exercising the same, but the weight just won't budge, and maybe it's even creeping up. During premenopause, many women experience sudden weight gain or notice their metabolism slowing down. It's not about willpower. It's about hormones. Estrogen plays a role in regulating insulin, fat distribution, and muscle mass. As it drops, insulin sensitivity can decline, leading to more fat storage, especially around the midsection. Plus, lower progesterone and rising cortisol, stress hormone, can increase cravings, water retention, and make your body hold on to fat more easily. The result? Weight gain that feels completely out of your control. But you're not imagining it, and you're definitely not lazy. Your body is shifting gears and understanding why is the first step to reclaiming your balance. If you've made it this far and thought, wait, that's me, more than once, you're not alone. Premenopause can feel like your body is playing tricks on you. One day you're energized and focused, and the next you're itchy, anxious, or exhausted. The hardest part? So many of these symptoms go unrecognized, or worse, dismissed. But now you know better, and when you know better, you can take action. You are not crazy. You are not broken. You are entering a powerful transition, and you deserve clarity, support, and compassion every step of the way. You are not alone in this. Here on Menopause Health, we're figuring it out together. One video, one conversation, one step at a time. This is your space, your community, and you belong here. If this resonated with you, subscribe for more videos like this and join the growing circle of women who are navigating premenopause with honesty, strength, and support.